Hello everybody, it's me Kunda again. I've got my mask, not because I'm sick, but because I'm cocky enough to think unless you see me with it in real life, you don't get to see me with facial hair unless you want to pay for it, so you can come see me on Discord if you're into that. And I've also got my Earl Grey tea still hopefully hot. And as far as references, which should remind us of the possibility that we could live in a post-scarcity society, I want to talk about our current government and correspondence I've had with them regarding healthcare. The current government being led by a party which seems to definitely not have it at heart that they want us living in a post-scarcity society. So, all that being said, I'm going to switch over to that correspondence without my webcam on so I can actually take this off. Yep, the Earl Grey tea is still hot. That said, sorry for the weird formatting of this that my Office app did. I'm going to read this out loud for those people who would rather just listen, and also because of the weird formatting of the first part, the part that I sent of this letter. So, good morning, Health Minister. I'll keep this short, but I'm hoping for a reply. I'm someone who takes my health very seriously in general. I think I'm pretty prudent about it. Under the previous provincial Liberal governments, it was easy to do. A little paperwork from my doctor, and I could go for a screening or an x-ray 3 or 4 days per week at whatever time ends up being convenient. In that I was talking more about the screening, less about the x-ray, but moving on. This new system is much more difficult. Seems to require more personal information, which history seems to confirm can be subject to hacks and leaks. There are now significant wait times, which for screening was never the case for me previously. And in general, the process of getting in has become much more inconvenient. As Health Minister, to give one example I'm sure that you can understand, sexual health is important. For anybody sexually active, sure, but especially for unattached, increasingly sexually active young people. Promptness both in being able to get in for testing quickly and for getting results back is vital to the health of people in our province. Which brings me to my question. I understand COVID may have changed things for a time, but will we be getting back to the level and accessibility of care we had when we were governed by other parties? Or is this the new normal we're just forced to accept under any NS progressive conservative government? Thanks for your time. Please provide me with some answers. Sincerely, not trying to disclose my full government name to the entire internet yet. So to dive into my letter to them just a little bit, my issues are basically this. Before, when I wanted to get tested, which I like to regularly do just for the safety of everybody involved, it was as simple as going to my doctor, letting them know, hey, I want this test. They would print me off a form, give me a cup, and I could go to the blood collection clinic whenever they happened to be available, which was at least a few hours, something like 4 or 5 days a week. It was a lot better than what the new system is looking like it's going to end up being, where they have us register for blood work, x-rays, probably a whole bunch of other stuff that you need to go to a hospital or maybe even a specialized clinic for, using an online portal, which both is inaccessible. Like, a lot of people just don't want to go through that process. Some people are just have a hard time navigating online internet anything, especially our aging population. No offense, I'm just saying I help my mom with her tablet all the time. And yeah, this is just not a good idea. And the other thing is that I mentioned data leaks and hacks, and that is another huge concern that comes about with this type of thing. Just here, Nova Scotia government dealing with another privacy breach posted in April 2018. I won't dive into the entirety of the content of these articles, but I'll link them all in the comments in case you want to. Another one. Personal data of 50,000 Nova Scotia healthcare workers may have been leaked through pension plan. This from March 2021. It seems to happen so often that the Nova Scotia government actually has a page on their website explaining what a privacy breach of personal information is, because, like I said, it seems that they're responsible for it happening so often, or at least responsible for not preventing it from happening. Anyway, to the credit of the Nova Scotia Progressive Conservative Party and the government in general, I did get a response, which I wasn't even sure I would get, so thanks to them for this much. I'll just get into reading it though. Dear, thank you for your email dated November 24th, 2022 regarding access to health screening services. As Senior Executive Director, the Minister has asked that I respond on her behalf. My apologies for the delay in response. Not much of a delay. They were pretty prompt, and I appreciate that. Unfortunately, at this time, we aren't able to meet all Nova Scotians' healthcare needs in the time frame and location that would be most convenient for them. We are actively working on a plan that will improve access to diagnostic imaging, including ultrasound and X-ray. Diagnostic imaging hours of operation currently vary across the province, and extending them requires an adequate supply of specialized staff. We are working on the issue by addressing existing staff vacancies gaps and expanding staffing to address needed increases in service volumes. Nova Scotia Health (NSH) maintains the confidentiality and privacy of individuals' personal information and personal health information while collecting, using, and disclosing information to follow applicable privacy laws, including the Freedom of Information and Protection of Privacy Act, FOIPOP, the Personal Health Information Act, PHIA, and Personal Information International Disclosure Protection Act, PIIDPA, which I didn't even know existed. Please know that you have the right to access your personal health information and request access to your PHI at any time. I understand your concern and frustration with the situation, and I can assure you that the Department of Health and Wellness is working with Nova Scotia Health to transform healthcare, so it meets the needs of Nova Scotians' communities now and into the future. Healthcare provider recruitment and retention and timely access for healthcare are top priorities for this government and are part of our plan, Hope for Healthcare. We are making progress, but the overall impact of these efforts will take time. I hope the above information is helpful. Sincerely, Tanya Penny, registered nurse. I assume this second title is related to Senior Director. Not sure. A whole bunch of other titles. ENC in brackets C, CBB, BSCN, MPA brackets M, Extra Fellow. Senior Executive Director, Clinical Portfolio. Sorry, that is a lot of titles. I want to know what you all think, and provide a space for discussion here in the comment section of this video. My thoughts on this: I think part of this is likely a form letter. I'm not certain of that, but it seems like a third of this is a form letter, maybe more, and the remaining portion is a genuine response from the Senior Executive Director of Nova Scotia Health and Wellness. And again, I want to applaud them for doing the minimal amount of actually responding to the inquiries of the people that they're ruling over currently. That said, this whole staff vacancy thing is a huge problem. It is a continuing problem for the progressive conservatives. We know it was a problem for the Liberal Party while they were in government. And this letter, it doesn't give me any reassurance that we're going to see that problem be solved anytime soon. It seems to indicate that they want us to think that there's a plan, that they want us to feel like it's a good plan. But reading the wording and reading between the lines, it comes off to me like they only have high hopes that they will be able to recruit healthcare professionals and fill the vacancies by that recruitment and training healthcare professionals and having them actually stay in the province. And my understanding is that for many healthcare professionals that get trained in our province, it seems like better opportunities for them once they have their training are elsewhere, and many of them move elsewhere, and I can't blame them for that. It's it's an unfortunate reality that all governments that I've lived under in my adult life, where I've been conscious enough to pay attention to what's going on in the world and politics around me, have dropped the ball on this. None of them have been able to make our Nova Scotia into a place that's prosperous for us, both as young people and for healthcare professionals, to want to stay. Some of us stay because we love it here, but we definitely don't stay because of the abundance of opportunities to be prosperous. We stay because we love it here and because we hope that we can help make it prosperous. But government is doing nothing or next to nothing to help facilitate that. Anyway, like I said, please talk about this stuff. Let me know what your thoughts are below in the comment section of this video. Share it widely if you'd like to, and if you like this kind of content to me, subscribe and let me know that you like it and want to see more of it. Take care, everybody, and, have a great rest of your weekend and holiday season.